good afternoon, everybody. We really appreciate you being here today. Melinda is not able to be with us this afternoon for the call. She had a conflict, so I'm going to fill in for you with the numbers that she usually does every week. So the latest COVID numbers, 1,103 residents, down from 384 from last week. Staff numbers this week are 2877. That's down from 186 from last week. So we're continuing to make progress and keeping those numbers at a low level. So we're really excited about that. And thank you guys so much for everything that you're doing on a daily basis still. I mean, it's been almost 200 days. I mean, it's just kind of crazy. And just FYI to add to it, and I know Dan's going to talk a little bit about it, received a call just a few minutes ago from the Florida Department of Health. And they're putting together a task force to look at how to distribute the vaccines here in the state. And they're telling me that the federal government will be responsible for working with the residents to get the vaccines to the residents. And then the local, state, and local Department of Health will work with the staff. So they're going to be working, the feds and the state, in conjunction with one another to bring the vaccines to Florida. So it's going to be interesting. We're going to sit on that task force to help them bring the vaccines into the state. So we're going to have Terry, is his name. He's going to join us next Wednesday on the call to give us an overview of what's going on. And I'm sure that we'll be working with the Florida Department of Health pretty closely once this gets rolled out. And also, Dan, you're probably going to give us a little information this afternoon about that as well. So, Jason, before we get started today, can you give us a quick update on last week's long-term provider conference call and the notes that you took? You're really good with that.
Absolutely. Thank you, Gail. So, the news from last week's industry partner call, this was the first partner call for October. It's been a continuation of what we've been seeing for the last several calls now. By and large, the highlights are the CDC guidelines are still in effect. Keep screening, keep your social distancing, keep making sure you're complying with PPE requirements, washing your hands. Remember that the CDC still has guidelines for when staff can return to work and quarantine, isolation, etc. Testing, we know it's not mandatory in ALFs, but ACA and Department of Health are still definitely encouraging it if you can do it. They're reminding us that about 40% of people who have COVID are asymptomatic and they don't have symptoms. So that kind of justifies the need for continued screening and making sure we're wearing masks and safety precautions. This last call did have one milestone. This was Secretary Mayhew's for the Agency for Healthcare Administration. Her last meeting, our last call as Secretary before leaving ACA to go become the ED for the Florida Health Hospital Association. We're looking forward to continuing to work with her there, and she received well wishes from everyone. As our members will recall, Florida Senior Living Association recently awarded Secretary Mayhew with a 2020 Assisted Living Champion Award. And this was for her continued dedication and hard work looking out for assisted living communities, especially during the COVID times. She really made an effort to go out of the way for us and to work with us. Also, two other things that were mentioned during last week's call, the Department of Health, they're working to reconcile confusion with the visitation policies, particularly here in Florida with the DEM Emergency Order 20-009, that's the modified visitation ban. They're wanting to reconcile that with the federal requirements for nursing homes from CMS. They're hoping to do that pretty soon. We were hoping that that may have come out this week, but so far not yet, so maybe we'll hear more in the next week. We did hear that CMS is working on a frequently asked questions document and anticipating that will clear up some confusion. And also in that area, and some of the CMP funds is going to be available to aid in visitation. People are going to have to, communities want to apply for that. And again, I want to see more of the what Florida does in that regard to see if we're really talking, does this apply to nursing homes or ALFs? That's something that we need to see. Anyway, at the end of the week, we were informed that that these industry partner calls, rather than being every week, they're now going to move to bi-weekly, so every other week. So we'll keep you posted on how that goes. I think the last time that happened, the visitation or the testing mandate dropped, so they were quickly imposed. But hopefully this is a sign that things are getting better. So that's that's kind of a summary of last week's call, Gail.
Thank you, Jason. I know we're going to continue to offer our calls every week as long as there's information that we need to share with you. And let me just say one thing too about the secretary. We had heard, and this is all, just hearsay, that they were going to try to find somebody from Washington, D.C. to step into that new position that was vacant by Mary Mayhew. She came from D.C. I know they had looked at someone from CMS. That didn't work out. Molly is stepping in the secretary role at this time. She hasn't been designated as the interim secretary, but she couldn't make the call today because she was had to step in for some of the secretary's workload, but she promised she would be on our call next week, and we really anticipate that guidance will, like Jason talked about, will be out next week. I know that there's a lot of discussion going on at ACA about nursing homes versus assisted living and what they're going to do with that CMS guidance, because we really, we're not federally regulated, nor do we want to be. So we're kind of pushing ACA to take a different approach for assisted living providers. So we'll just wait and see what they come up with. So I'm going to turn this over to Dan. We really appreciate you, Dan, being here today. Dan works with Argentum, which is our national association and the leading association exclusively dedicated to supporting companies operating professionally managed senior living communities. So we're really excited to have you with us today, Dan. I know you guys up in Argentum, that you've been doing so much work and, kind of given us a lot of heads up on the funding, the testing, and you kind of hit the ground running when you started with Argentum, because COVID came right afterwards, and I know you've been working really hard. You're the Director of Government Relations, and your responsibilities include monitoring legislative and regulatory issues affecting senior living, and you oversee the association's Political Action Committee, and you advocate for policies that support choice, independence, dignity, and quality of life. So we really appreciate you being with us today, Dan. We're going to mute our phones and let you take it away.
Thank you so much, Gail. Screen. All right, you can all see my screen now? All right, well,
yep, we got it.
Thanks again for having me. I do really appreciate the opportunity to talk with you all for a few minutes about what's going on here in Washington. And I was saying earlier on our broader state partners call, it's been a pretty wild and strange week, even by Washington standards. Just the amount of activity that's been going on, between the president's diagnosis and all the ups and downs with the negotiations. It's kind of hard to know where things are standing, but for the moment, or at least until we get the next tweet from the president, when things could change, hopefully we can give a little bit of a lay of the land of where things are, at least for right now. So go to the next slide. Just very briefly, this is a quick summary of some of the highlights of the past 7 months or so. Gail alluded that I'd started at Argentum last December, sort of thinking that we'd be spending the year more focused on getting our message cut through all the noise on retirement income security and workforce challenges. But obviously because of COVID, our industry has been a lot more in focus than ever before. And this presents both challenges and opportunities. Hopefully there's more opportunities. And you'll see that's represented here in the work we've done with the administration, with Congress, with the media, and of course, with all of you. So again, briefly, I just want to give a quick rundown of where we've come from. This was the first legislative package that was passed in early March, and it really laid the groundwork for the emergency paid leave, which partially impacted this industry. And I have a little bit more on that on this next slide. And this was the follow-up package, or the Friday the 13th package, as I call it, since it was advanced on Friday, March 13th. And this had laid more of the groundwork on that paid leave. This only applied for operators who nationwide have fewer than 500 employees. So again, the bigger operators, this does not impact, but for all those smaller operators, this can have a massive impact and really be devastating for the workforce, especially with the provision for paid leave for workers who are affected by school closures. And this does apply for schools that are physically closed but are offering virtual learning, and that does include those schools that are physically closed and offering virtual learning because of a intermittent outbreak. So I'm not sure where all the schools in Florida necessarily land on reopening, but this is an important point to keep in mind for any operators that may be affected by the paid leave here. That said, we were able to get some guidance issued by the Department of Labor back in April that exempted all senior living workers from being eligible for this paid leave. And we believe this is within the law's original intent to ensure that the healthcare workforce would remain able to assist on the front lines during this crisis. But in August, a New York federal court had overturned this as being too broad. It applied to the employer rather than the employees. So as a result of that ruling, the DOL had provided an alternative in a revised guidance that would apply only for direct care staff in senior living, but not for the support staff. So important distinction, and this could still have huge impacts for those operators that are affected by this leave provision. We continue to advocate for the Department of Labor to appeal the ruling or otherwise work it so that the vast majority of workers would be covered in this exemption. But as of right now, that's where that stands. And I do have a summary of this rule and how this all works that I can share with you all after the call. But the next package was the CARES Act, and we could probably spend all day on this, but I'll just highlight that this is what included the Provider Relief Fund, which senior living entities are eligible for, and we had specifically lobbied to make sure that private pay senior living entities would be eligible for the Provider Relief Funds. I'll have a little bit more on that later on. So the next package was CARES Part 2, and this came just a little bit after the CARES package. It basically nearly doubled the size of the Provider Relief Fund, and it added significant sums to the Paycheck Protection Program. And that sort of leaves us here. So in May, the House had passed the HEROES Act, and that's the one that's on the left side of your screen. And this was purposefully a wish list, kitchen sink, throw all the spaghetti at the wall and see what sticks. And it was an all-in-all comprehensive package. That said, it wasn't really a serious proposal in the sense that House Democrats had expected Senate Republicans to take it up, but it was their initial offer to start negotiations. Importantly, it didn't include liability protections, but this again was purposeful by House Democrats to be able to have a negotiating item to work with Senate Republicans. And then on the right side of your screen, you'll see that the Senate had proposed a collection of bills that they collectively called the HEALS Act. And this was much more slimmed down from the HEROES Act, again, purposely so they would have their own negotiating start point to draw from against the HEROES Act. And after that, they offered their own slimmer version of that they had proposed in early September. And in the Senate, you do need 60 votes for cloture or otherwise to begin debate on a bill. And when they brought it up for a cloture vote, they only got 52 votes. So the bill wasn't even actually considered for a vote, and therefore it actually doesn't have an up or down vote. that's sort of where negotiations have been really since May, and where they've been since the Senate had taken or attempted to take up their HEALS Act. We had initially had a lot of optimism back in May when the House had passed the HEROES Act, knowing that the HEROES Act itself wasn't really going to be going anywhere, but we had really believed that that was going to jumpstart negotiations on a very broad package. We had thought there was going to be a deal certainly by Memorial Day, but at the very, very latest July 4th. And I know that Gail and Jason will remember our state calls that we do every week, hearing me sort of string along every week, and it's coming, it's coming. We feel really good about this. And of course, talks have just broken down every week from there. But we did have a little bit of hope earlier on this week until the president yesterday afternoon had tweeted there would be no deal until after the election. And I think this caught everybody pretty off guard. And if you were following the stock market, I'm sure you saw the stocks literally just falling off a cliff right as that tweet came out. And I think it was also a little bit surprising just politically, given the near universal support for a package. The polls that we've seen on it have been really 3-to-1 of 75% of poll respondents have said they support a massive upwards of a $2 trillion aid package. So the announcement yesterday by the president that they weren't going to do anything until after the election, I think caught everybody a little bit off guard. But after the president had tweeted last night, I think sort of sensing that missed opportunity, the president did say that they would be moving on a deal, probably be more focused on the Paycheck Protection Program funds and the airline bailout. I think within the past several weeks, airlines have been most in the spotlight, given the tens of thousands of jobs that are at stake without having a deal. So that's really been what's sort of jump-started this, and what initially at the beginning of this week gave us so much promise that there was going to be a deal. So where does that leave us otherwise? Liability, unfortunately, it seems to be most on the chopping block. The president doesn't fully have his support behind it, and at least he doesn't seem to be a big key advocate for liability protections, but he has said that if he wins re-election, it will be a priority. And obviously this is not a Democratic priority. It wasn't included in the House Democrats' plan. Liability protections have historically not been in the Democratic wheelhouse. So if Biden does win, it's highly unlikely to be passed, and especially if Democrats also take back the Senate, which is looking increasingly likely. So, we think there's otherwise a lot of support for more funding, especially from the Provider Relief Fund. And that does take me to our priorities, and specifically on the financial relief, which is, if not our top priority, certainly among our top priorities. And we were really pleased that we did finally get recognition from the Provider Relief Fund with an allocation that was based on 2% of gross revenue from patient care. As you all know, of course, this is not nearly enough to cover all of your increased expenses and lost revenue attributed to COVID. And after they put forth this 2% of gross revenue allocation, they did just open up another allocation for all providers who previously got anything from the fund. So this is hospitals and dentists, everybody who got anything from the fund now has the ability to get additional funds. So this next phase is open through November 6th. And it's for, again, any provider who didn't reach that 2% to be able to get up to that level, and they'll be providing additional support on top of that through a formula they have not yet announced. So,
Dan, let me just stop you right there for a second and ask you to please go through this one more time, because I know that we have been sending this information out for people to apply. So, and a lot of questions have come up about if they applied for the funding, the previous funding, can they apply for this funding?
Yes. So if you applied either from the Medicaid allocation or from the private pay allocation, you are eligible to apply for this additional revenue and or additional funding. And if you were in the Medicaid revenue, they did have a different formula than the private pay, which is why some providers may not have gotten up to that 2% of gross revenue. This allows you to be able to get up to that 2% of gross revenue. And we're trying to underscore the fact that senior living providers have not really gotten the same support as a lot of other providers, including the skilled nursing industry, which has received over $12 billion in support, specifically from the Provider Relief Fund, in dedicated allocations on a per community and a per bed basis that senior living entities have not received. Again, our allocation was strictly the 2% of gross revenue, and it's a far cry from what other providers have received.
So 2 more quick questions and I'll let you go back to your presentation. 2% of the gross revenue still from 2019?
From 2019, yeah.
And how, is there an application form on HHS, or you guys have that where they can go to apply for those funds?
Yeah, so there is an application form online. It actually just opened on Monday and it's open through November 6th. We are looking to get some more resources put together on this. And as we have those, we'll share them with you.
Okay, great. All right. Thanks, Dan. I'm sorry. I just had to interrupt you.
No worries. Absolutely. So I was saying that with this distribution, we are, asking to get additional money allocated specifically for senior living. As I mentioned, SNFs had received substantially more in the Provider Relief Fund. So we are asking specifically for a carve out of a set amount of funds from this $20 billion to be made available for the testing and vaccine distribution, or if there's additional funds from the Provider Relief Fund that can be earmarked for that, we would certainly be appreciative of that. But again, we're really underscoring the disparity that senior living providers have received from the Provider Relief Fund compared to other industries. So we've had a lot of good discussions on this on the Hill and with the administration. So hopefully there's more to come, but I do want to make sure that you are all aware of that, of the current allocation and application timeframe, and you all are able to take advantage of that. So with liability protections, as I said, it's not looking good to have these adopted through legislation in a COVID package. There's certainly opportunities, but right now it's looking like a narrower chance that this is going to be passed by the end of the year. We are working to have the PrEP Act be used to give some legal coverage, certainly through the courts. And this in itself could probably be its own hour-long discussion. And it actually is its own hour-long discussion. We had done a webinar on this with our legal task force a few weeks ago. So please feel reach out to me and we can get you connected to that webinar and learn a little bit more about how the PrEP Act can give some more protections, both for staff and facilities. But beyond the PrEP Act and our efforts to get something passed through federal legislation, we'd also worked on a state-by-state approach, implementing executive orders or legislation. And we were able to get some protections in about half of all states. I know that Florida had been dangling out there for quite a long time, and I'll defer to Jason or Gail to give a little bit more of an update on the efforts that are underway in Florida specifically. And then with PPE and testing, we were really happy to see that the administration made senior living a priority for the Abbott Binax Now antigen rapid tests. We do have a little bit of concerns about how this is being distributed. I think a lot of communities received a letter saying they're going to be receiving all these tests, and the next day they show up on the doorstep. So we want to make sure these are a little bit better coordinated. I know there's going to be a lot of resources in doing this and any reporting requirements that are attached to it. So we are asking for a little bit more support and resources in carrying this out. And along the same lines with vaccines, we know this is going to be just an enormous undertaking for distributing nationwide upwards of 2 million vaccines for senior living residents and another million for the caregivers. So we are asking specifically for a little bit more support on that. Thankfully, we were included as a primary priority in the latest National Academy of Sciences recommendations that they finalized on Friday that places generally senior living staff in phase 1A and senior living residents in phase 1B, which is what we had asked for when we had submitted our own recommendations to the draft recommendations a few weeks ago. So we're very pleased with that, and you know, we are going to be working with the administration on this distribution. You know, there's just obviously a lot of logistics to work out. I think it's going to be quite a bit for communities to be administering these, especially for the larger, you know, 200, 300, 400 bed communities, or even larger. Beyond that, just in terms of man hours to do this, a lot of the leading vaccine candidates that we are following right now, basically these would be delivered and they need to be fully administered to everybody within a matter of hours. I think we're seeing upwards of 8 hours at the upper limit of that. So it's going to take a lot of staff resources, and we are really underscoring that message on the Hill and to the administration right now that we need support if we're going to be effectively delivering the vaccines, and on top of that with the testing. So with regards to visitation, I am really pleased that Argentum was able to finalize, and we released an essential caregiver model. And this helps to open up visitation where it's otherwise very restricted. And I know in Florida, you all can do outdoor visitation for a lot of months of the year, more than say in Minnesota. But you know, we've had a lot of great success, Minnesota being one of the states actually that was a leader in developing an essential caregiver model that we've since been able to make into a model regulation, and are working to get this adopted in a number of states beyond the few that have already moved in that direction. And Gail, I see you come back on here. I know that Florida had initially had an essential caregiver model, and it sort of moved back. Do you have an update on that?
Well, that's one of the issues that we're waiting on ACA to make a decision on, because, you know, it doesn't match the CMS guidelines. But what's, you know, the compassionate care that's in the CMS guidelines doesn't mention essential caregivers. So at one point, ACA was like, well, you know, the federal guidelines trump the state guidelines. But now we're hearing there's a possibility that ACA may still recognize those essential caregivers for, you know, assisted living providers. So we're, you know, and I think that's part of the reason that we haven't seen the latest guidance yet from ACA, is because they're trying to figure out what they want to do, whether they want to have the caregivers, the essential caregivers, or not for assisted living providers. So we're just going to have to wait, and hopefully we'll have an answer. You know, we were hoping for Friday. The ACA usually sends out notices Friday at 5 o'clock or whatever. So we were hoping that we would see something on Friday, but we haven't seen it yet. And Molly promised us that it would be out maybe next week. So, you know, Dan, we'll just sit tight and see what happens. But I know, you know, most of us here in Florida, they've created their policies and procedures on their essential caregivers. They have those recognized now and picked out. We did do a short survey a couple of weeks ago on just the numbers of visitation, and that was very interesting to see that it was between 30 and 50%. So it wasn't the mass amount of visitors that we thought it was going to be, you know, at the beginning. So I think our communities are handling it very well, and they're doing a great job. So with that, I'll let you go back to it.
Sure. Well, hopefully we get some more progress back again in not too long. And then finally, I did just want to close with some raising some questions that the industry will be facing in the coming months and years. Clearly, we're increasingly being seen as a healthcare entity, and that's something we've generally avoided, you know, to be seen as a healthcare entity for years and years. But as we are increasingly seen as a healthcare entity, this is going to open up all sorts of new federal scrutiny. We saw earlier this year, Senator Elizabeth Warren and Senator Ed Markey and Representative Carolyn Maloney had opened up their own oversight investigation of senior living. And I think that's just sort of a preview of things to come. But we believe strongly in the state regulatory framework. We believe it's worked really well. We think that operators have, by and large, really taken on this challenge, head first and come out very well in this. And we've seen sort of the opposite approach in skilled nursing that has had quite a bit more challenges. And of course, they have substantially more federal oversight. So. We think that our case is pretty strong, that the state regulatory framework has worked out very well in this case, and we'll be continuing to emphasize that, especially if we do have any changes in the administration or in Congress that might lead to changes in more oversight. That said, obviously COVID has completely changed so many facets of everyday life. Here in this country and beyond. So I know it's just the same in this industry. So we are going to need to be preparing for all these challenges moving forward. And we're just raising these questions now and starting to just get ahead of ourselves as we do prepare moving forward. So with that, I will just close and say thank you all for everything that you are doing day in and day out. It's not going unnoticed. Everybody we talk to on the Hill and the administration recognizes the incredible value of all the critical work you all are doing. We just need to make sure that you all have the resources and support that truly acknowledges everything that you all are doing for your residents. But, with that, I'll pause and take any other questions you do have.
That's great, Dan. I think we do have some questions, and we'll turn that over to Jason.
All right. So yes, we had, looks like we have one question here. Are we advocating for the CMP funds to filter for ALFs? Do you have any info, knowledge, or thoughts about that?
So can you clarify the CMP funds?
The CMP funds are funds that come in from lawsuits here in Florida, and they have to be approved by CMS anytime anybody applies for those funds. It's a special trust fund that ACA has, and when anybody applies, especially nursing homes that can apply, assisted living can come or supposedly apply for these funds. CMS has to approve it. Is that right, Jason?
Yeah. So there's down here. This may be more Florida specific, but down here in Florida, there's a trust fund. It's comprised of two things: of the CMP money that Gail was talking about, and then settlements from ALF stuff. So the settlement from ALF cases, I think ALFs can have the potential to access. The CMP one has generally been nursing home type funds. So I guess they're maybe shifting the question a little bit. This is something I've wondered about. Right now, ALFs are not federally regulated, by CMS or CDC. If there is, one question I've had is, if the federal government wants to give us access to some of the funds they've been giving nursing homes, would they more or less give ALFs access without any strings attached, or would they want to say, hey, the type of guidelines that are applying to nursing homes, the CMS type guidelines, are those conditions that you would have to more or less take on yourselves now and have applied to you if you want to get this federal money? Have you heard any conversations about strings being attached to the money in that concept?
I don't have anything on my end, but it's something we can certainly look into.
Yeah, and hopefully we can find out when when ACA sends out some guidance that Gail was talking about. Hopefully we'll have some stuff. But that's one of the, I guess, the nuanced questions that I've always wondered about, or I'm always wondering about, is with ALFs not being federally regulated, to what extent or how do you apply federal guidelines? Down here in Florida, what we'll see, say for example, is there's no specific rule, or at least historically, barring the last emergency order, there's been no rule or order saying comply with CDC guidelines. The way the agency will get around that is rather than saying you have to comply with the rule, at the tail end of the process, there's the potential you may have an enforcement action for violating residents' health, safety, welfare. And you're violating it because you didn't comply with the guidelines that probably everybody complies with. So that's been one of the things we've been looking at. Looking to other questions here. This one popped up. Have you heard of CARES funds based on COVID positivity versus county positivity rates?
Not specifically. There was some funding made available on a state-by-state basis that states could determine how they want to distribute those funds, and there's a lot of autonomy on that. I don't know how that was handled specifically in Florida, but with the antigen tests, those were tied more towards the actual positivity rates. So they did have, it was based on red, yellow, and green counties. Red and yellow counties getting the first order of priority, and then they'll circle back with the green counties. All communities, I believe, are getting this first round that runs through December, but the order of the number of tests that are being provided is based on the positivity rate by the county.
That looks like it's all the questions that we have. And with that, I think we may be okay. Gail, do you want to take back over? You're on mute, Gail. There we go.
There we go. We appreciate everything that you're doing for us, Dan, and please let everybody know up there that we just are so thankful that you're there to help us out. And I know that we'll be hearing more information from you real soon on, if you can continue just letting us know about the funding and what's coming down the pike. We really appreciate it. So, and thank you for being with us today. We felt like this is a really helpful call to let everybody know, about still testing, visitation, it's still top of mind for everybody, and especially the funding now. So we want to try to get as many funds to assisted living providers as possible. Our dues are coming up pretty soon. So we want to make sure that everybody gets some money for sure. So thank
Absolutely.
you, Dan, for joining us today.
No, thank you.
Before we go this week, we've got some other business to talk about. Jason, you want to talk a little bit about what's going on with all the Q&A from last week?
Yeah, thank you, Gail. So, last week our Q&A, we had a great session with Kim Smoke from ACA. It touched on several different topics, and we had a lot of interest from our members after the meeting about some of the information that was provided. So what we'll be doing shortly is we'll be sending out an email that contains not just last week's information, but all of the information for September. So all these webinars we're doing, we've been recording them. We're going to have links to the webinars. We're going to have copies, PDFs of the PowerPoint presentations. The Q&A document, you can see an example on your screen here. All the Q&As that we've done, we'll have those links, so you can basically have one-stop shopping for everything that's happened. For last week, there were a lot of topics that we had Q&A on, visitation, testing, activities, what happens when residents leave the community, community services, staff and business operations. Basically looking at my copy here, we're at about just at 5 pages of questions and answering that we've been working on. So we took the questions, we're rephrasing them a little bit, we're getting the answers that Kim had, but we're also, as you see an example, providing specific information where we may have other sources. So if we can tie the answer back to an emergency order, or back to verbal guidance, or back to another document, and provide a little more context, we're doing that. You'll also see where here at Florida Senior Living, where we sent out previous emails, we will try to link back to those as well, so you know that you can go back and look at one of the articles we've written to provide more context that you might not get in a short soundbite. So with that, we're at 4:38. Gail, do you want me to go to the next slide, or do you want me to highlight some of the Q&A we have?
Yeah, if you want to, I do want you to talk just a little bit more, if you would, about the dining. I know this continues to be a real issue for everyone, and so Jason, if you could just spend just a couple of minutes talking about the communal dining one more time, I think that will be very helpful.
Absolutely. So this was a question that we had on our Zoom meeting last week and in the industry partner call last week. And it was kind of interesting because I think a lot of people, there are some people thought of what happened as new news. And, to a degree from the communal dining aspect, it's been more or less, what we have been saying for a while. So basically, well, I'll back up. And the question we had last week is, with the governor's executive order going to phase 3, are we able to open up communal dining and activities? Now, remember, there's two things, communal dining and activities. So we're going to look at the communal dining part right now. And really, so communal dining, the answer was, in the short answer was yes, with caveats. But the communal dining, what we've heard from ACA, and we put out this information in one of our members-only rapid response emails, article about it. It can resume. It's been able to have been in place since, I want to say maybe late May. But you have the community, you have to adhere to your infection control practices as outlined by the CDC. So we're talking about social distancing, using face masks, hand hygiene, cleaning the area between settings, full infection control. And also you want to check your local ordinances to see if they have something stricter. So that was the answer last week, and it's consistent with what ACA has given in previous guidance. And this is the quote from ACA that we've historically been giving out. So, quote, as outlined in the CDC guidance, ALFs may allow residents to have meals in a shared dining room as long as the facility adheres to proper social distancing. This would only be permissible for residents who are not positive for COVID-19, are not a PUI, and have no signs or symptoms of COVID-19. Please refer to the CDC guidelines for additional instruction. And for our members, if you want to go back and search your emails, we have that information of that article in Florida Senior Living's Rapid Response number 4. So dining is allowed. It's, the executive order doesn't handicap that. We're not to full-blown, true pre-COVID communal dining, but a modified communal dining with proper safety controls. One thing to think about, keep in mind for your members is, while this may be an option, you want to look at your dining room capabilities, or where your residents can dine, what their capabilities are, how many they can serve with these modified restrictions, what your kitchen can do, because although communal dining might be possible, as a community, you may not be able to serve all of your residents in that dining area within a meaningful window. If you're serving breakfast from 6 in the morning till 11:30 in the morning, is that something you really want to do? That's a business call for our communities, but something to think about. Do you how you might roll out that dining? So you may have a modified example where you do communal dining for certain people, and you do in-room dining, in the residence room dining for other people. That's a business call for everyone to work out, but it is a option on the table. A couple of the other questions I will highlight, and then before we close it out with our last slide or two, we had one question: do essential caregivers or compassionate care visitors, are they included as private duty aides and hospice nurses, or do private duty aides and hospice nurses, are they included as EC or CC? And the answer there is no. They have their own separate form, separate exemption. If you look at DEM Emergency Order 20-009, there are specific exceptions to the visitation ban for hospice, palliative care workers, for residents in end-of-life situations, as well as individuals or providers giving necessary health care to a resident. So if you're hospice, if you're a private duty aide, you do not fall within the essential care or compassionate care visitors. One more question that popped up: has there been any update to visitor screening regarding cruises and travel outside of Florida? The answer we had last week, there's no CDC quarantine for interstate travel. However, check with your local community requirements. They may have something stricter. The new screening criteria from DEM Emergency Order 20-009, individuals who want to get in, they are not allowed to enter. There's 3 things. If you're infected with COVID and you don't meet the most recent criteria from the CDC to end quarantine, that's the first one. The second one is that any person presenting signs or symptoms of or disclosing the presence of a respiratory infection, including cough, fever, shortness of breath, sore throat, chills, headache, muscle pain, repeated shaking with chills, new loss of taste or smell, or any other COVID symptoms identified by the CDC. So that's one thing you'll have to keep an eye on, is what symptoms is the CDC identifying. And the third one was any person who has been in contact with any persons known to be infected with COVID who does not meet the most recent criteria for CDC. So this new order is now looking at CDC guidelines. I'm not going to go through all 4 pages, but I'll see if 1 or 2 more jumped out at me. If an ALF has met the 14-day requirement, are they permitted to start group activities and or open the dining room with the social distancing in place? The answer there was the requirement, and then the new emergency order is that the community have no new facility onset of resident or staff cases. This applies to general visitation and the barbers, beauty salons. It does not apply to the group activities or communal dining. Can residents leave the community? Yes, they can. They can go out with family members and friends. They can leave for, per the emergency order, they can leave the community temporarily for medical appointments, and then they have to wear a mask. There's a basic exception in the emergency order that if the residents leave for a temporary medical appointment with a mask and come back, they don't have to be quarantined for that reason. But I would point out, and I think we've addressed this in Florida Senior Living in our COVID update number 52, and you can see this on our website. We wrote an issue brief on the subject. It's really a business call. There's not a bright line ban for if residents go out, automatically they're quarantined. You're going to have to make a risk decision on the resident, their physical symptoms, how they are, where they went, who they met with, who they talked to, how long they were gone, were they wearing PPE, what is the risk of that resident having something, and what is the risk of that resident giving something to other residents. There's no bright line answer. It's a tough case by case call for every community. Here's one. Can we resume resident van rides around the area or trips to the store? Absolutely. But make sure the residents are wearing masks, practicing their hand hygiene, social distancing, disinfect the van when they get out of the van. And let me see here. Oh, and here's one on one we've had for our spa, and this will be my last one before I'll turn it back over to Gail. Can our massage therapists return to our spa and manicurists? And the answer was that massage therapists and manicurists do fall under salon services. So yay for that. Thank you, Kim. And just be sure to refer back to the DEM, the emergency order 20-009, for the requirements for barbers and beauty salons to be able to resume services. There are requirements they do have to meet. And with that, we do have about 5 more questions that are pending answers from ACA. They're relating to tests, the CLIA waiver, entertainers outside the building, church services, ACA's still looking at that. Therapy pets, ACA's looking at that. What about if you have a big spa? Can they use more than one client if they're socially distancing? ACA's still looking at that too. So those are things that ACA's continuing to look at, and hopefully next week we can get some clarity. So with that, Gail, I will.
Jason, I think we have one question.
No, we do. Hang on. Let's back up here. See if I can get to my meeting control.
If you'd like, I can read it to you.
Now here we go. Okay, for independent communities, do we follow county guidelines for dining or the governor's executive order to fully open? I thought the new executive order superseded county guidelines. Okay, the first one there is ask your own attorney, because I can't give you legal advice. So my non-legal off-the-cuff thoughts are, the executive order is the executive order, but what it did, remember, you can't, it doesn't allow fully opening. So whether you're talking visitation or communal dining, it's not talking about fully opening. So just be careful there with the nuance. What the executive order did, as I recall regarding county guidelines, is it said that the counties can't have fines against individuals, but I think some counties are saying or choosing to interpret that to still allow fines against businesses. So what I would suggest you do is consult with your attorney and check your local county to see how they're choosing to interpret the governor's the governor's executive order. So I want to be careful not to get us, Florida Senior Living, in giving legal advice to 3,000 different communities. But that's my recollection of what the order says. But check with the local counties just to make sure, because I think I've seen different counties either interpreting it or implementing it in different ways as to whether or not they will go after local businesses.
Well, you know, Jason, we had that call last week where one of the local Department of Health folks was saying that in independent living that their dining was considered a restaurant because they served liquor, and that was not the case at all. So I think, you know, sometimes we have to educate folks on what's really the case. Independent living is not regulated, so the rules are a little bit different for them. And so, like Jason said, I would suggest, you know, reaching back out to your local Department of Health and trying to clarify. And if you have any problems with that, reach out to us and we can contact someone from the state level and try to get an answer for you if you have any problems with that. So with that, I think that's the end of this week's call. We're looking forward to next week. We're going to have Molly McKinstry and someone from the Department of Health talk about vaccines. So we're excited about that. And thank you guys so much for participating this week. We really appreciate it. Just keep tuned in and we'll join you again next week. Thank you guys. Yay.